Acute paralytic poliomyelitis, a highly infectious viral disease caused by the poliovirus leading to the acute flaccid paralysis due to the anterior horn cell destructions in the spinal cord. Cause agent poliovirus type 123, a member of the Picornaviridae family, spread via the fecal oral route or the respiratory droplets. Pathophysiology, virus enters via the oropharynx or the gastrointestinal tract, multiplies in the gut-associated lymphoid tissue, spreads hematogeneously to the central nervous system, attracts the motor neurons in the anterior horn of the spinal cord, causing the flaccid paralysis. Clinical features like incubation period 6 to 20 days. Stages: minor illness like fever, malaise, headache, sore throat, vomiting, non-specific symptom. Aseptic meningitis phase in non-paralytic cases, stiff neck, back pain and the meningitis. Paralytic phase in 1% of the cases, asymmetric flaccid paralysis, proximal distal limb involvement, absent deep tendon reflex with a preserved sensation. Bulbar involvement may cause respiratory failure. Types of paralytic polio. Spinal polio. This involves the spinal motor neurons. Bulbar polio affects the cranial nerve, leading to the dysphagia, dysarthria, and the respiratory compromise. Bulbospinal polio. Combination of the spinal and the bulbar involvement. Diagnosis: clinical evolution like flaccid paralysis without the sensory deficit. Laboratory confirmation: poliovirus isolation from stool, throat swabs or the cerebrospinal fluid. Elevated CSF protein with the normal glucose and the mild pleocytosis. PCR for the poliovirus RNA. For management, supportive care like mechanical ventilation for the respiratory failure, physical therapy to prevent the contracture and maintain the muscle strength. Prevention: vaccination, inactivated poliovirus vaccine, injectable, part of routine immunization schedules. Oral poliovirus vaccine, live attenuated, used in the endemic area for mass immunization. Complications like permanent paralysis, post-polio syndrome, last onset muscle weakness years after the recovery, death from the respiratory failure in the severe cases. Poliovirus is a member of the Picornaviridae family, spread by the fecal oral route. Causes the anterior horn cell destruction leading to the flaccid paralysis. Paralysis is asymmetric with proximal to distal limb involvement. Bulbar involvement can cause the respiratory compromise. CSF findings like elevated protein, mild pleocytosis, normal glucose. Isolated from the stool, throat swabs or the CSF. Vaccination: IPV, injectable, safer but provides no gut immunity. OPV, oral, induces a mucosal immunity but the risk of vaccine-derived polio. Post-polio syndrome, late onset muscle weakness in the previously affected muscle. Prevention includes the mass immunization campaigns to interrupt the transmission. Paralytic polio occurs in less than 1% of the poliovirus infection.